Hello, my name is Tracy Blair, and I'll be talking about health disparities analysis on anxiety and evidence-based practice recommendations. I would first like to start off with a 1-minute video to show what anxiety is, how it affects people, the symptoms of anxiety, and how many people are affected by it, and how to treat your anxiety.
As you approach the podium, your heart rate jumps, your mind blanks, and your chest tightens. You start to feel as if at any minute you could die. Occasional anxiety is an expected part of life. For a person with an anxiety disorder, the anxiety does not go away. Anxiety disorders can get worse over time. Symptoms of anxiety disorders include restlessness, fatigue, irritability, trouble concentrating, and difficulty sleeping. About 1/3 of US adults experience an anxiety disorder at some time in their lives. Finding ways to relax can help. So can talking about it. Connecting with family and friends can help you cope. If your symptoms don't go away, talk with a healthcare provider. While living with an anxiety disorder isn't always easy, there is hope. With treatment, different types of talk therapy, and possibly medication, you can take back your life. To learn more about anxiety disorders, visit the NIMH website. And if you found this Mental Health Minute helpful, please share it.
According to the National Institute of Mental Health, anxiety can be defined by many different types. The most common anxiety disorder is generalized anxiety disorder, which involves a persistent feeling of anxiety or dread, which can interfere with daily life. It is not the same as an occasional worrying about things or experiencing anxiety due to stressful life events. People living with generalized anxiety disorder experience frequent anxiety for months, if not years. Everyone's experiences of anxiety disorders are different. Not everyone who has anxiety disorder will experience the same symptoms. On the United Kingdom's mental health website, they have symptoms for anxiety listed with both mental and physical. Some mental symptoms include feeling irritable and trouble sleeping, while physical symptoms could include dry mouth or shaking. Just to give some examples of what could cause anxiety. In infants, it could be associated with genetics. In pediatrics, it could be from bullying or where you live. In adults, it could be from unemployment, being addicted, or poor health conditions. In the elderly, anxiety might be related to having too many bills or having no family support or their health. Let's explore anxiety using the 5 objectives in the World Health Organization's social determinants of health. Who defines the social determinants of health as the conditions in which environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. They include factors like social economic status, education, the physical environment, employment, and social support networks, as well as access to healthcare. Social determinants of health and mental health go hand in hand with health equity. The WHO says risk factors for many common mental disorders are heavily associated with social inequities, whereby the greater inequity, the higher the inequity in risk. We're going to take a look at each one of these factors. The first one we're going to look at is neighborhood and built environment. A study performed by Han and Lee studied family connectedness and its association with fewer depressive symptoms. Another study by Wang showed that anxiety disorders were correlated with having poor family functioning. Both noted how important it is to have family support to help with anxiety. In addition to family support, working on the environment, like creating bike trails to exercise and decreasing gun violence, fall under this factor. Under the next factor, health and healthcare, we witnessed many disparities during the COVID-19 pandemic. We saw people during the pandemic suffer in areas of low income and poor health. People's anxiety rose due to stress of unemployment, dying family members, and having decreased social interactions. Social and community context includes teenagers. It is estimated that 3.6 to 4.6 of teenagers experience an anxiety disorder, and anxiety and depression can affect school attendance and school work. And social withdrawal due to anxiety can lead to depression and possibly suicide. Nursing as a profession is known to be a stressful occupation. Nursing students and new graduates, nurses, often show signs of stress and anxiety either in the classroom, clinical setting, or taking care of their very first patient. Anxiety within the workplace consists of work constraints, lack of supplies, missing necessary information about how to complete tasks, and inadequate staffing. Anxiety disorders can cripple concentration, making it difficult to deal with the problems. Under economic stability, the elderly are a group that are affected by it. Between 3 to 14% of older adults meet the criteria of diagnosable anxiety disorder. And in a recent study in the International Journal of Geriatric Psychiatry, 27% of older adults have symptoms of anxiety, which impacts their function in life. Many elderly individuals live on fixed incomes and struggle with paying their bills. And unfortunately, they're often the victim of financial abuse scams. Evidence-based practice involves evidence with clinical knowledge and expertise while considering patients' unique needs and personal preferences. While using evidence, it can improve and achieve optimal patient outcomes. The next couple of slides will go over examples for each social determinants of health, examples of how to improve person's anxiety using evidence-based practice. The example of evidence-based practice includes the family. Families, when involved in their child's care, when they are having surgery, have less anxiety when they are present. A study by Maletti concluded a randomized controlled trial generalizing all patients could benefit from identifying their anxiety prior to surgery and benefit from being prepared with the help of their family. Under the health and healthcare and COVID-19, we learned that telehealth and telemedicine can help with increasing the care of patients with COVID, and this can now carry over to healthcare today. Attendance can significantly be improved by using telehealth visits, and this can cover anxiety too. One positive thing that came out of the pandemic. Remember that teenagers are exhibiting anxiety while in school and in social life. There are 2 studies that show yoga and social emotional learning aids in helping kids manage their anxiety. And some of the social determinants of health objectives overlap. Neighborhood and environment built can help with decreasing anxiety in teenagers by building those bike trails, and keeping kids safe at school will help reduce their anxiety. Nursing students and new nurses struggle with learning all of the content they need to care for their patients. 2 studies that identified anxiety as a problem came up with some solutions. One was having an app on their mobile phones to help reduce anxiety, and the other highlighted having a workshop to address students' anxiety. Both noted having tools in place to help increase self-efficacy and well-being. Finally, when you look at evidence-based recommendations for elderly, 2 studies explored reduced anxiety in older adults. One included using aromatherapy, and the other incorporated a community-based, person-centered, flexible, and culturally tailored program called Calmer Life. Calmer Life was studied in the Afro-American low-income mental health underserved community, providing them with counseling and the option to include religion and spirituality. Both studies were effective in reducing anxiety in the elderly. This slide summarized the 5 objectives of social determinants of health, along with highlighting different situations affected by anxiety, and then ending by noting evidence-based practice examples of how to reduce anxiety. The goal of this talk was to identify a health disparity affected by social determinants of health. We focused on anxiety. Anxiety is unbiased and impartial. It affects all humans. In fact, there are 40 million adults affected by anxiety today. We have evidence to show that there are programs and treatments that help reduce anxiety in people. The Anxiety and Depression Association of America states anxiety disorders develop from complex set of risk factors, including genetics, brain chemistry, personality, and life events. The World Health Organization has goals and objectives for the Healthy People 2030 campaign, which includes anxiety. Let's take a look at what our future holds for mental health research and discovery and hope through the Institute of Mental Health.
In the aftermath of World War II, America faced a great and compelling need to address the nation's mental health. In response, President Harry Truman signed legislation leading to the 1949 creation of the National Institute of Mental Health.
It has been tolerated too long. It has troubled our national conscience, but only as a problem unpleasant to mention, easy to postpone, and despairing of solution. The time has come for a great national effort.
The National Institute of Mental Health was at the heart of this effort.
For the first time, man now has the tools to explore the living brain.
Today, the National Institute of Mental Health is the lead federal agency for research on mental disorders, supporting discovery across the country and the world. We aim to transform the understanding and treatment of mental illnesses through basic and clinical research, to envision a world in which mental illnesses are prevented and cured.
Thank you for listening today about anxiety.